Stand up right now. Go ahead. I'll wait patiently while you do it. Now, really pay close attention to how your body feels in this exact moment. Do you notice any subtle aches somewhere in your back, or perhaps in your abdomen? Maybe a little stiffness quietly settling into your joints, or an unusual sense of tiredness that just seems to linger much longer than it normally would? So many people simply brush these kinds of sensations aside without giving them even a second thought. They assume it's nothing more than the result of a long day, perhaps some minor strain from routine activities, or just the ordinary wear and tear that naturally accumulates as the years go by. But what if I told you something truly important? Some of the most serious health issues we face don't arrive with loud, dramatic announcements. Instead, they whisper so quietly and so persistently that they become incredibly easy to overlook until they eventually grow into problems that are far more difficult and sometimes even impossible to treat effectively. One of the most dangerous examples of these silent warnings very often comes from your pancreas, that small but absolutely vital organ tucked quietly behind your stomach. I'm Dr. Aur, and for more than 25 years, I have devoted my entire medical practice to caring specifically for adults over the age of 60. Through all those years, day after day, I've witnessed the exact same troubling pattern repeat itself over and over again. While growing older certainly brings some natural and expected changes to how our bodies function, aging by itself does not and truly cannot explain every single new symptom or gradual shift that suddenly appears. Far too often, genuinely serious underlying conditions manage to hide themselves very cleverly behind what most people mistakenly assume are just typical, unavoidable signs of getting older. Pancreatic cancer stands out as one of the clearest, most deceptive, and unfortunately common illustrations of this quiet, insidious process. It almost always begins in an extremely subtle way, showing up with such mild, vague, and nonspecific signs that the great majority of people either ignore those hints completely or casually attribute them to minor everyday issues, temporary stress, small diet changes, or simply the natural passage of time and years. Most people carry a mental image of pancreatic cancer as something that arrives suddenly and violently, striking with intense, crippling pain or clear, unmistakable red flag alarms that immediately demand urgent attention. But in the real world of everyday clinical practice, that dramatic picture is usually not how the disease actually unfolds for the majority of patients. Instead, it typically develops slowly and very stealthily over many months, revealing itself only through gentle, easy to dismiss hints that build up gradually and quietly. These early clues often include unexplained and unintentional weight loss that catches you by surprise, a constant mild but nagging ache located in the upper abdomen or mid-back area, small but persistent changes in the way digestion feels or functions day to day, or brand new difficulties in keeping blood sugar levels stable and predictable as they once were. When you examine each one of these symptoms completely in isolation, it can easily seem unimportant, completely ordinary, or even something to be expected as a normal part of growing older. Yet when two, three, or more of them start appearing together over time and begin forming a recognizable, repeating pattern, that combination turns into a clear and urgent message straight from your body, one that should never ever be brushed off, downplayed, or dismissed lightly. Over the next 20 minutes or so, I truly want to walk you through my 6-step early protocol in careful detail. This is a practical, structured system that I have personally developed, carefully tested, and steadily refined throughout many years of direct hands-on clinical experience working every day with older adults just like you. The protocol is specifically designed to help people recognize these early pancreatic warning signs and respond to them in a realistic, measured, and effective way. Every single part of it draws directly from well-established, high-quality research and trusted clinical guidance that comes straight from the world's leading medical institutions, including Johns Hopkins, the Mayo Clinic, and the Cleveland Clinic. Please understand clearly that my goal in sharing all of this is absolutely not to frighten you or stir up unnecessary anxiety in any way. My sole purpose here is to equip you with straightforward, practical, evidence-based awareness so that you will know exactly when it truly makes sense to start listening more attentively to your body's soft, quiet signals, when those signals genuinely deserve closer and more serious medical attention, and, most importantly, when the wisest choice is to take prompt, decisive action without unnecessary delay. Before we dive any deeper into the specifics, I would really appreciate it if you would take just a quick moment right now to drop a simple comment below letting me know your current age. Seeing those numbers helps me get a clear sense of exactly who is here, watching and listening with us today, and it allows me to keep shaping and tailoring future videos and content so they serve the different age groups who join us as effectively and helpfully as possible. With that small request out of the way, let's begin by explaining, clearly, plainly, and in straightforward everyday language, what is actually happening inside your body as the years continue to pass. As we enter our 60s, 70s, and even beyond, it is completely normal and entirely expected for the pancreas to undergo some gradual natural changes over an extended period of time. The gland may slowly start producing slightly smaller quantities of the important digestive enzymes it used to release so abundantly in earlier years. And its essential role in carefully regulating insulin production and helping maintain stable, reliable blood sugar levels can become a little less precise and a bit less consistent than it once was. These subtle, ongoing shifts frequently begin to influence things like daily appetite, overall energy throughout the day, and the body's natural ability to hold a comfortable, stable weight long before any larger, more obvious, or more alarming problems ever become clearly visible on the surface. Picture your entire digestive system as a well-run kitchen that, little by little, over many years, starts to lose some of its most skilled and experienced team members. When those key digestive enzymes, absolutely necessary for properly breaking down fats, proteins, and carbohydrates, begin to drop off in quantity or effectiveness, the food you eat simply doesn't get processed or absorbed as efficiently as it used to, even if you're consuming exactly the same kinds and amounts of food you've always eaten. As a direct result, your body ends up taking in fewer nutrients and fewer usable calories from the very same meals. Over time, this inefficiency very often leads to a gradual but very real and unexplained loss of weight that can genuinely surprise you and sometimes even surprise the people closest to you who know you well. You might suddenly notice that your clothes are hanging noticeably looser around the waist, chest, or shoulders without any intentional effort on your part. Quite often, it's actually family members or close friends who notice the change first and mention it to you with genuine concern, wondering if everything is okay. A well-known study conducted at Johns Hopkins involving 1,500 adults, all age 65 and older, clearly demonstrated that individuals experiencing these early pancreatic changes frequently lost between 7% and 10% of their total body weight over a period of just 6 months, without making any deliberate adjustments whatsoever to their eating habits, exercise routines, or daily lifestyle. In those situations, it's incredibly common for people to assume they're simply eating a bit less, without realizing it, or perhaps feeling full much faster than before, so they casually blame the whole thing on normal aging. But when that kind of ongoing, truly unexplained weight loss continues steadily and without any obvious cause, it absolutely deserves a serious, open conversation with your doctor as soon as possible. Another area where confusion arises very frequently is the specific type of pain most commonly linked to pancreatic problems. It is almost never the sharp, sudden, stabbing kind of pain that grabs your full attention immediately. More typically, it presents as a dull, steady, persistent ache located in the upper abdomen or right in the middle of the back. A large number of older adults naturally connect that kind of discomfort to things like arthritis, poor posture developed from years of prolonged sitting or standing, old sports injuries that never quite healed fully, or general muscle strain from daily life. However, pancreatic issues have a way of quietly pressing on nearby nerves and surrounding tissues, creating exactly that kind of ongoing, nagging ache that stubbornly refuses to ease up no matter how much rest you get, how many over-the-counter pain medications you try, how diligently you do physical therapy exercises, or how much time passes. It's very much like a slow, hidden leak developing behind a wall in your home. You can't actually see the water damage yet, but it's steadily causing harm beneath the surface. Inflammation builds up quietly in the background, sending out those faint but persistent pain signals that are all too simple to ignore or rationalize away day after day. Data compiled by the Mayo Clinic from more than 1,200 patients clearly showed that around 55% of them experienced some form of back pain or upper abdominal discomfort for 6 months or longer before their pancreatic cancer was finally diagnosed. If you happen to be dealing with that kind of ongoing upper belly or mid-back pain that has no clear, identifiable reason behind it and shows no real improvement, despite trying all the usual remedies, please take a moment right now to add the word alert to your comment below, so I know this particular section really resonated with you personally. Another sign that often begins very quietly but gradually becomes more noticeable and concerning is jaundice. the distinctive yellow tint that appears in the skin or in the whites of the eyes, frequently accompanied by unusually dark urine or pale, clay-colored stools that look noticeably different from normal. This particular change happens when a growing pancreatic tumor starts pressing directly on the bile duct, blocking the normal flow of bile, which is the important fluid essential for proper fat digestion. Bile functions very much like a steady, continuous river that carries critical substances away from the liver and gallbladder. When that flow gets obstructed, bilirubin builds up in the system, leading directly to the yellowing of the skin and eyes, persistent itching, and noticeable shifts in both digestion and the appearance of stools. Research from the Cleveland Clinic indicates that in roughly 65% of relatively early-stage cases, jaundice shows up after some of the milder symptoms have already been present for a while. So when it does appear, it serves as a particularly strong and urgent signal that immediate medical evaluation is needed without delay. If you ever notice any of these specific changes taking place, please seek professional help right away. Don't wait to see if it fades on its own. Because the pancreas plays such a central and indispensable role in producing insulin and helping control blood sugar levels throughout the body, any significant disruption in its function can quickly lead to unstable or unpredictable glucose readings. This might manifest as brand new diabetes developing after the age of 50, or it could show up as sudden, unexpected difficulty in managing blood sugar that had previously been well controlled for years with medication and consistent habits. Insulin functions very much like a precise key that unlocks cells throughout the body so glucose can enter and provide the energy we need to function normally. When insulin production drops off, becomes irregular, or loses some of its effectiveness, sugar remains circulating in the bloodstream instead of fueling the cells properly. This leaves you feeling drained of energy and contributes significantly to increased fatigue that can become quite profound and persistent. A notable study published in the journal Diabetes Care, which followed 750 adults experiencing sudden shifts in their diabetes patterns, found that fully 5% of them were later diagnosed with early-stage pancreatic cancer, a rate that stands significantly higher than what occurs in the general population. One of the most common mistakes people make is examining each of these symptoms completely on its own, in isolation from the others. Unexplained weight loss by itself could easily stem from a reduced appetite that comes with age, a temporary change in eating patterns, or other benign causes. Back pain alone might very reasonably be tied to posture issues, muscle strain from daily activities, or long-standing arthritis. New or suddenly harder to control diabetes could seem purely genetic, related to lifestyle factors, or simply a progression of an existing condition. But when two or more of these signs begin occurring at the same time and persist together, the overall level of concern rises sharply, and that combination truly calls for prompt, thorough medical evaluation. To help illustrate exactly how these symptom patterns can play out in real life and lead to meaningful outcomes when addressed early, let me share two brief but powerful patient stories from my own practice. First, there was Margaret, who was 68 years old when she first came to see me. She had always been remarkably healthy, very active, and completely independent, enjoying daily walks around her neighborhood, tending to her garden with enthusiasm, and spending joyful hours with her grandchildren. Then, over the course of just 3 months, she noticed she had lost 12 pounds without making any intentional effort to do so. At around the same time, she developed a dull, persistent ache in her upper back that simply wouldn't improve, no matter how much she stretched, rested, or adjusted her posture. She also began feeling unusually full after eating only small portions of meals she had always enjoyed in the past without any trouble. When she finally came in to see me, she was clearly puzzled and more than a little worried. She told me plainly, "Nothing in my routine or my eating habits has actually changed at all. I'm doing everything the same way I've always done it." We immediately put the early protocol into action. Careful short-term tracking of her symptoms, targeted blood tests, prompt imaging studies, and some thoughtful nutrition adjustments to support her digestion. The blood work revealed elevated liver enzymes that raised concern, and follow-up scans identified a small lesion in the pancreas. Because we caught it relatively early, she was able to undergo surgery successfully. Afterward, she gradually regained 8 pounds. Her energy levels returned to what she remembered from before, and she later said to me with genuine gratitude, "I feel like myself again. I'm so thankful we didn't wait any longer to investigate." Next was Robert, who was 72 at the time. He had successfully managed type 2 diabetes for 15 solid years, using medication and maintaining very consistent daily habits that kept everything stable. Then, over 6 months, his blood sugar levels began swinging wildly up and down, despite no changes whatsoever in his routine, diet, or medications. His stools started looking pale, oily, and unusually difficult to flush away completely. On top of that, a deep, unrelenting fatigue settled in, making even simple daily activities feel exhausting, even after what should have been a full night's sleep. At first, he waited and tried to explain it away as just part of getting older, or perhaps a side effect of his long-term medications. When he finally opened up about all of it during a visit, we applied the early steps right away to connect the dots. Detailed testing revealed signs of bile duct blockage, and targeted imaging confirmed the presence of a small tumor. Early surgical intervention helped stabilize his blood sugars dramatically, eased the profound fatigue, restored more normal digestion, and greatly improved his overall quality of life in ways that made a tremendous difference for him and his family. These real-life stories, and so many others I've encountered over the years, powerfully demonstrate just how much spotting subtle patterns early and acting on them thoughtfully can truly transform outcomes and preserve both health and independence for much longer. Now let's move directly into the heart of what I use every single day in my practice: the early protocol in its complete 6-step form. The very name early was chosen deliberately because catching these patterns at the earliest possible stage truly changes everything about the possibilities moving forward. Over time, I've expanded it carefully into 6 clear, actionable steps to provide fuller, more comprehensive coverage for those who follow it. Step 1. Track changes carefully and consistently. Make it a regular habit to weigh yourself once a week at the same time of day. Note any shifts in your normal appetite. Carefully log any abdominal or back discomfort you experience. Keep track of your overall fatigue levels. Pay close attention to the color and texture of your stools. And, if diabetes or blood sugar concerns apply, monitor those readings diligently. Use whatever simple tool works best for you: a basic notebook, a notes app on your phone, or a dedicated journal. And always record the date, the strength of each symptom on a straightforward 1 to 10 scale, and any relevant notes about meals, activities, or other factors that day. Patterns that emerge over time reveal far more than isolated single moments ever can. Research from the Mayo Clinic has shown that consistent, detailed tracking like this can actually boost early detection rates by as much as 40% when the information is shared openly and thoroughly with your doctor. Bring that journal with you to every medical visit. Be as specific as possible. Instead of vaguely saying, some weight loss, try stating clearly, I've lost 10 pounds over the past 3 months. I feel full unusually quickly after meals, and I've noticed my stools are pale and harder to flush. That level of precise detail helps guide the right tests immediately, such as liver function panels, bilirubin checks, or appropriate imaging studies. Step 2. Tackle any changeable risk factors as actively and proactively as you can. If you currently smoke, make quitting a top priority and seek support to make it happen, whether through counseling, nicotine replacement, or other proven methods. Work toward maintaining a healthy, stable weight through balanced, nutrient-rich eating. Keep alcohol consumption to low, moderate levels or eliminate it if advised. Take active steps to manage diabetes or prediabetes as effectively as possible under medical guidance. Information from the Cleveland Clinic clearly indicates that consistently addressing these modifiable factors can reduce the risk of progression by anywhere from 20% to 30% in individuals who already carry higher than average risk. Incorporate plenty of fiber-rich whole foods, lean sources of protein, and healthy fats into your daily meals to support both digestion and more stable insulin function over time. Step 3. Ask confidently for the proper testing whenever concerning patterns begin to emerge. Start with straightforward blood tests that check liver enzymes, bilirubin levels, and possibly the CA19-9 tumor marker when appropriate. If those results or your symptoms warrant it, move forward to imaging options such as an abdominal ultrasound, a contrast-enhanced CT scan specifically targeting the pancreas, or an MRI for the clearest possible views of the area. Early tumors are frequently very small, so it's important to keep advocating for answers if symptoms continue without a satisfactory explanation. Persistence here can make all the difference. Don't hesitate to follow up or seek a second opinion if needed. Step 4. Build and maintain supportive daily habits that strengthen your body. Drink plenty of water throughout the day to stay well hydrated. Choose meals packed with nutrients to maximize what your body can absorb. Engage in gentle but regular exercise such as walking or light resistance training to keep circulation and energy flowing. and place strong emphasis on supporting gut health through fiber and balanced nutrition. Studies published in leading gastroenterology journals have demonstrated that adopting a nutrient-focused dietary approach during these early phases helps sustain energy levels and significantly reduces the likelihood of additional complications. In cases where digestive enzyme production is noticeably reduced, doctor-supervised enzyme supplements may improve nutrient absorption, but only ever under direct medical supervision and guidance. Step 5. Pull everything together intentionally for the best possible results over time. Make a firm commitment to noticing and respecting your body's signals rather than automatically labeling every new change as just aging. When you follow the early protocol steadily, something remarkable often happens. In week 1, careful tracking begins to clarify emerging patterns and reduces unnecessary worry by replacing uncertainty with structured planning. By week 2, test results start providing concrete information, while simple diet and hydration adjustments frequently bring noticeable improvements in energy and digestion. Weeks 3 and 4 guide the next logical steps, whether that's a referral to a specialist, additional scans, or further lifestyle refinements, and many people report feeling tangible daily gains in how they feel overall. After about 4 weeks of consistent effort, you naturally build lasting, empowering habits, wider treatment options if needed, and far wiser decision-making capacity. This process represents genuine empowerment, not passive waiting for things to worsen. Step 6. Keep awareness sharp and maintain strong teamwork indefinitely. Review your symptom journal regularly to spot any new trends, discuss test results, and progress openly with your doctor at follow-up visits. Involve family members or caregivers so they can offer additional observations you might miss on your own, and remain flexible and responsive to any changes that arise. When you treat the early protocol as an ongoing, lifelong routine, rather than a temporary fix, it becomes a powerful foundation for sustained health awareness and proactive care.